Today, we're diving into a fascinating study about acupuncture reducing nausea in palliative care patients. Let's get started.
That's intriguing. What's the study about?
Researchers in Denmark conducted a randomized study, and they wanted to see if acupuncture could help alleviate nausea in terminally ill patients.
Oh, that's really interesting. How did they set it up?
Well, they took 136 patients, mostly with cancer, who were in hospices, and randomized them into two groups. One group received acupuncture alongside usual care, and the other just the usual care.
Right. And what were the results?
After 3 days, 75% of patients in the acupuncture group had reduced nausea,
That's
compared
impressive.
to 55% in the control group.
That's quite a difference. Did they look at vomiting too?
Yes, but interestingly, acupuncture didn't significantly reduce vomiting. Both groups saw similar reductions there.
That's curious. Do you think acupuncture specifically targets nausea but not vomiting?
It's possible that, nausea and vomiting are mediated by different mechanisms. Acupuncture might be more effective on the sensation of nausea.
That makes sense. But couldn't the improvement be due to the overall care environment rather than acupuncture?
Well, that's a fair point. The study mentioned the hospice environment itself can reduce symptoms, but the
Exactly.
significant difference suggests acupuncture adds an extra benefit.
True, but without a placebo group, it's hard to be certain it's the acupuncture making the difference.
Yeah, that's one limitation.
Yeah,
But in practice, if patients feel better, it's a positive outcome regardless.
I agree. Were there any side effects from the acupuncture reported?
Actually, no significant side effects were noted. It's
That's good.
considered safe and well tolerated.
Did patients express any preferences regarding acupuncture?
Yes, about 67% had prior experience with acupuncture. Some even declined to participate because they didn't want to risk not receiving it.
Wow, that shows strong patient preference.
Exactly. Respecting patient values is key in palliative care.
Absolutely. Do you think implementing acupuncture in hospices is practical?
Well, nurses can be trained to administer it safely. It doesn't
Right.
require extensive training for specific points.
But wouldn't that add to their workload?
It might, but integrating it into routines could make it manageable. And the benefits to patients could outweigh the extra effort.
That's a good point. Improving quality of life is crucial.
Exactly. And since it's inexpensive and safe, it's a valuable addition to holistic care.
Yeah. Were there any other interesting findings?
Well, patients in the control group increased their use of antiemetic medications more than those in the acupuncture group. So acupuncture
really?
might reduce reliance on medications.
That's significant considering medication side effects.
Absolutely. Less medication means fewer side effects and interactions.
Right. Did the study have any limitations we should consider?
Yes. Most participants had cancer, so results may not generalize to other illnesses. Also, the placebo effect can't be entirely ruled out.
That's true. So more research is needed?
Definitely. Further studies could strengthen the evidence and explore other patient groups.
Exactly. It's encouraging, though, to see positive results.
For sure. It's exciting to think acupuncture could become standard in palliative care.
Absolutely. Well, this has been a really insightful discussion.
Yes, it's been great exploring this topic. I'm eager to see how this influences future care practices.
Yeah.